Otitis Externa. The word Otitis Externa means ot, ear, itis, inflammation, and externa means the external ear. As you know, ear has three parts, the outer, middle, and inner ear. The function of the outer ear is to collect and transmit sound to the middle ear, and the middle ear will amplify the sound and the sound move and vibrate the head of stapes, and which subsequently it will cause the cochlea and flute to move, and this movement will be transferred to the part of the brain where it will be perceived and interpreted. Otitis media is different from otitis externa. Otitis media is the infection of the middle ear, whereas otitis externa is the infection of the outer auditory canal. Otitis externa is also called swimmer's ear because it is common on those whose ear is wet. The underlying pathophysiology for otitis externa is if there is anything that will change the acidic environment in the external auditory canal. This is because this acidic environment has a protective effect from bacterial and fungal overgrowth, and there are different risk factors and causes for these things to happen. The risk factors include swimming, humidity, ear devices, trauma, skin abnormalities like eczema, psoriasis, and medical conditions like diabetes, immunosuppression, radiation, and also narrow anatomy is also a risk factor. And the cause for otitis externa can be infectious and non-infectious causes. And the most common identified etiologies are mostly bacteria, which are Staph aureus, Proteus, E. coli, and Pseudomonas. From fungal causes include Candida and Aspergillosis. Clinical features. The most common identified clinical features include ear pain or otalgia, which will be worsened when there is pulling on the pinna and palpating the tragus. There will be ear discharge, which is offensive, pruritus, sensation of ear pressure, erythematous and edematous external auditory canal, tinnitus or ringing sensation on the ear, and hearing loss because of the obstruction. Otitis externa can be mild, moderate, or severe. Mild means when there is pruritus and mild edema. Moderate means when there is external auditory canal is partially obstructed. Severe means when the external auditory canal is completely obstructed and there is systemic symptoms. There are some subtypes of otitis externa. The first one is eczematous otitis externa. It's when which occur because of dermatitis or skin problems within the external auditory canal. And the features or clinical features include pruritus, scaling and flakings, and the discharge during eczematous otitis externa is clean discharge. The second one is necrotizing otitis externa, which is also sometimes called malignant otitis externa. And in this case, there will be severe deep pain, and that will most commonly involve the temporal bone, and it's common usually in elderly, diabetes, and immunocompromised person. The third one is otomycosis. This is types of otitis externa when it is caused by fungal cause, and also it is common in diabetic patient, elderly, and there will be malodorous discharge. Diagnosis. The diagnosis can be made clinically, but the physician can use otoscope to visualize the auditory canal, and sometimes culture may be required to differentiate whether the cause is bacterial or fungal cause. The other is CT scan. It is important to visualize the temporal bone. When we come to the treatment will be first identifying the etiology and giving appropriate antibiotics, anti-pain, topical ear drops, usually which consists acidic content. And if there is severe, recurrent, or not responding, usually the patient may require inpatient admission and there may be IV or IM antibiotics requirement. Thank you for watching. Don't forget to subscribe, comment, and share.